All right, media, we're just going to give it just a few more minutes, still just a couple minutes before 2:30 starts. So just to continue to hold tight, and we'll start very soon. All right, thank you everyone for joining us today. We are just working on some technology things right now. I know a couple have requested if you can have access to record this. So we are working on that access here right now. So we will get started in just a second with the actual press conference. So continue to hold as we allow you that access. All right, thank you everyone for joining us today. We are streaming this live, and we have given you all access as well to record this if you would like. Today we wanted to give you an update within Kalamazoo County, what is going on with our COVID-19 response and also with our vaccine distribution. We appreciate you taking the time to be with us today. We're going to start off hearing from Health Officer Jim Rutherford. Then we'll transition over to Administrator Morad, who will then transition it over to Chair Hall. And so with that, I'm going to let them get started with their update. I'm going to take my screen off. Once we're done with that update, I'll come back on and then we'll open it up for questions.
So thanks, Lindy, and I want to thank all of you for taking some time out of your day to meet with us. We have a lot of demand, obviously, within the community, a lot of questions and frustrations from residents, and you know, we want to remind people that this is going on all over the country as it relates to when am I going to be able to get my vaccine. While this is a good sign that we've got a significant amount of demand, it's also very, challenging at every local public health department in terms of being able to answer all of that demand. I appreciate Chair Tracy Hall and County Administrator Morad in joining me today. From my perspective, I wanted to update you where we're at with the dissemination or distribution of the vaccine. Obviously, there's the prioritization that the governor has provided for the state of Michigan residents. We are in the tail end of 1A. That is our first responders and all of police, fire, all of those individuals within our healthcare settings. There are only 3 entities within Kalamazoo County that are receiving vaccine at this point in time. Both Bronson and Borges Health System are 2 of them, and then local public health is this 3rd. So we're excited about the fact that we are completing 1A and moving into phase 1B. But phase 1B is a really, really large list of individuals, upwards of 60 to 70,000 people. So, it's going to take some time to be able to make sure that everybody has an opportunity to get the vaccines within 1B. We're allocating vaccine internally within 1B. We're prioritizing 50% of the vaccine that we receive for people over the age of 65. 25% of the vaccine that we're receiving are going to be distributed for our K through 12 educators, staff within our schools and child care facilities. And then the remaining 25% will be allocated for clinics for essential frontline employers. All the while, we're prioritizing for our vulnerable populations as well, and I'll explain, how that works. The rationale for this approach is really when we look at the population over the age of 65, they account for 80% of the 272 deaths that we've encountered or that we've experienced in Kalamazoo County has been experienced within this population. They also are hit the hardest and most significantly by illness as a result of contracting COVID. The hospitalization rates are much higher for individuals within this population. The other considerations, particularly within our education system, we really want to work very diligently with our partners in the schools, making sure that we provide as safe of an environment as possible for our students as they continue to return to face-to-face learning. As many of you may know, the governor's directive is that all schools are back to face-to-face learning by March 1st. So it's imperative that we diligently try to get as safe an environment as possible within our schools. And then I want to talk a little bit about the vaccine supply. As of Thursday, January 14th, we have received 6,825 doses of the Pfizer vaccine. Of that, we've administered 5,262 doses. Currently, we have an inventory of 3,245 doses, which are all allocated for clinics that we have scheduled for next week. Approximately every week, we receive about 3,000 doses. That's very small compared to considering the fact that we need to vaccinate tens of thousands of people. That's a very small quantity. I will comparatively remind people that there are counties in the state of Michigan that haven't even been able to have their first clinics, and we've had many clinics, thereby being able to vaccinate well over 5,000 people. We are planning on holding 3 clinics a week. We do 2 large clinics at the Expo Center. These are all by appointment only. Right now, we're able to do about 1,500 people per day at each of those clinics. As the vaccine supply increases, we know that we can easily ramp that up to over 300 a day. We are, working on those partnerships. We can't do this alone at local public health. I mentioned that both our hospital systems are readily involved within the vaccination process as well. We've reached out to the National Guard seeking their support. We've got great relationships with entities like Western Michigan University School of Medicine, with our Family Health Center. All of those, it's just a coordinated event. We know that people are frustrated. We have developed a wait list for people over the age of 65. This is the pre-registration form that's on our website. We want people to get their name on this wait list. We'll begin to populate that calendar over the course of the next several clinics. People can call but we know that the phones, there's a long wait list, and we get thousands of calls on a daily basis. Please reserve those phone lines for people that don't have access to the website. Remember, there's a great deal of people over the age of 65 that might not be able to have that access. We ask people to really be mindful of their family members, their friends, their neighbors. If you know somebody over the age of 65 that wants to get on the wait list, help work with them. That's really, something that we can do to help assure that we get people into these clinics. Our COVID Center call number is 269-373-5200, or you can go onto our website, which is www.calcounty.com/COVID19.php. As of 1 o'clock today, there's over 15,500 people on the wait list. That gives you some perspective of the demand in the community. We're scheduling all of these by appointments, but it's going to take some time. We're only as quick and rapid as the supply of vaccine that we get. I want to also make sure that everyone is mindful of our endeavor to be as equitable as possible. While we establish a wait list, there's some limiting ability in terms of access. So the third clinic that we design are out clinics, where we go out into the community, meeting people in their own areas, working with homeless populations, working with our elderly that aren't able to come into a large clinic, making sure that we're not marginalizing anybody, making sure that everybody has an ample opportunity to seek out the vaccine. So with that, we've got a lot of great partnership within the county, and I'm going to turn it over to Administrator Morad for her to talk a little bit about that. Tracy?
Thank you, Health Officer Rutherford. I would just like everyone to know that Kalamazoo County government is committed to expediting the COVID vaccine as efficiently as possible. The countywide effort throughout Kalamazoo County government as the employer, not just the health department, but we have 900 employees that are all focused on delivering this vaccine to the community. Highlighting some of those are the Sheriff's Office, the Office of Emergency Management, Information Technology, Parks and Recreations, Buildings and Grounds, even the Finance Department when it comes to expediting the funding for this. And I want to thank all of those employees and let the community know that we are all working on your behalf. Just to reiterate the supply vaccine, it is limited right now. As Health Officer Rutherford mentioned, we are getting just under 3,000 vaccines per week. Our current wait list for just the 65 and over is over 15,000. And what that translates, if the vaccine supply stays current as is, it could be weeks and several months before we get through that list. So we ask for your patience. We also let you know that we are equipped and have a plan to vaccinate thousands per day once the vaccine distribution increases. So as of all of you are waiting, we are waiting for the distribution increase as well. So just to reiterate, we are here for you, we do hear you, and we are ready to put action in place as soon as we get those vaccines. I will now like to transition over to our board chair, Chair Tracy Hall.
Thank you, Administrator Moore. Good afternoon. I just want to spend a little time just acknowledging the frustration from our residents. I'm one of 11, but the 11 of us on the County Board of Commissioners, we hear you. We are asking your questions. We're taking those questions directly to the Health Department, directly to Administrator Morad. I know there's a lot happening, but we're hearing you, and I wanted to lift up your frustration. I have my own friends and family who are feeling very similarly. And just want to also reiterate or remind that eligibility does not equal availability, and to get the vaccine to everyone that is now eligible will take time. And again, acknowledge there's going to be some frustration with that, but asking for some patience as our health department and our other county departments continue to roll this out. I appreciate Director Rutherford's equity lens because this is so important. And I appreciate the fact that our HCS has included smaller outreach or will include smaller outreach clinics, and proud to see that equity and access are being included within our health department. And just kind of wanted to also reiterate what Administrator Mord said about our county as a whole. Our county has fully taken this process on, from our Parks and Rec and our Expo Center to our IT department to building and grounds. As a member of the County Board of Commission, I couldn't be prouder of our 900 staff from our various departments as well.
All right, thank you very much for that update. We're going to open this up now for questions. If we can, just unmute yourself, and we'll just go around as equally as we can to answer a question. If you can, try to leave it to just one question and maybe one follow-up, just so we can get through everyone that's on the line here. I see Lindsay has unmuted herself. We'll let you go first, and just maybe state your name and what organization you're from.
Hi, this is Lindsay McCormick with Wood TV. I really appreciate that you guys are doing this. This is phenomenal transparency. I am wondering, I just got confirmation from Kent County that they've discovered that some people who are currently eligible, because there are multiple providers, have somewhat been, I guess for lack of a better term, hoarding appointments. So they're going in and they're actually able to make multiple appointments through those different providers, thus slowing down the process even further by showing up to the one appointment and not canceling last minute those others. So has that been something you've identified? Is there any message that should be shared to people related to that?
Sure, Lindsay, that's a great question, and that's been a concern of ours for quite some time now, given that both the information systems that the health system use versus the information system that we use are different platforms, so they really don't speak to each other. But I can assure you that we speak to each other very regularly. We meet with representatives from both health systems. We're addressing that reality. I think that most people are going to take advantage of getting their name on any list that they're eligible for, and certainly I understand that. We would ask the general public that in the event that they are successful through one avenue, to please, if they're on a couple of different calendars, please reach out to those other entities and cancel that appointment, thereby allowing somebody else to take that spot. And then we continue to have those conversations with both the partners that are administering vaccines within the community, making sure that we're not having duplicate entries on alternative lists.
Thank you.
All right, Brad, would you like to go next?
Yes, thanks for taking my question. The 15,500 mentioned on the waiting list, is that just describe all of the people in 1B who want to get it? Is that correct?
No, the reality is 1B is probably closer to 70,000 people when we take into consideration that most demographically people over the age of 65 constitute approximately 40,000 plus residents. So then when we get into all of the essential employees coupled with staff within our school system, coupled with some of those vulnerable populations, we're well into 60 to 70,000 residents.
Okay. And do you have a date when you expect to do the first vaccinations, actually dosed shots into people's arms for 1B?
We'll start seeing some of those presenting at our clinics next week on the 19th and the 20th.
Thank you.
All right, we can take any other questions. Okay, Tricia, you can go ahead.
Hi, I was just wondering, some people are questioning who's able to get the vaccine first and who's not, and we know the state health department has kind of laid out a plan for that, a priority plan. How are you guys maybe monitoring or keeping track of people so they don't skip the line, or like what qualifications do you have to get the vaccine at a certain time? How do you guys track that?
So that's going to be dependent upon the population that are actually receiving the vaccine. So when we were dealing with people in 1A, we tried to batch those out, working with respective fire departments, working with law enforcement, working with those first responders in a batch methodology where they would send all of those individuals or sign them all up at the same time. Now that we're moving into a much broader category with 1B, we have to be mindful of the population that we're trying to reach. The objective is really to vaccinate as many people as possible. And when we look at people over the age of 65, we'll most likely be asking just for their date of birth. But I'm not going to, our mindset isn't that we're going to turn anybody away. However, we want to be pretty diligent about making sure that we're allocating the resources where they need to go. And when we talk about, again, reminder that age group 65 and above, those are the individuals that have really bared the brunt of this disease. We have people that haven't been able to visit their elderly grandparents or their parents for almost a year now. So I just ask the community to be mindful of that and to be mindful of, this is the population that has, had the most fatalities, the most deaths as a result of this, the most, medical attention is being applied towards this population. So, but when we get into some of the more vulnerable populations, and I'll use an example, I had a conversation with, representatives from our homeless shelters today. Not all of those individuals have ID. So we'll be working with those organizations. But again, our objective is really to vaccinate people in their environments if necessary, and just be mindful of those respective situations that may require us to kind of do it a little bit differently and based upon where we're doing it.
Thank you. Do we have any other questions from any other media? Okay, hearing none, I'm going to just open it up for any final thoughts that our panelists would like to leave us with. And so I'll start first with Health Officer Rutherford. Do you have any final thoughts, not just for our media, but for our general community?
Yeah, again, I appreciate my bosses here, sidling alongside me. This is taking the entire community. And when we look at the partnerships and the progress that we've made, we're really in a good spot. And I want people to know that, we've got this. It's just going to take some time. And unfortunately, all of the variables that we need to have in line, some of them are out of our control, the most important of which is having that vaccine. But know that we've been planning this for many months now. We've got a structure that allows us to very rapidly ramp up to where we can be doing in excess of 3,000 vaccines at each clinic, knowing full well that our health systems are doing the same. And ultimately, most likely the Family Health Center will begin engaging in that work as well. So I want to remind you that, just be patient, be understanding, help your neighbor, help people over the age of 65 that might not have the resources that you and I have as it relates to connectivity to internet, as it relates to the wherewithal to be able to get signed up. Just be mindful that it's going to take some time. When we get through 1B, we'll be moving into 1C. You'll see some different types of opportunities for drive-through clinics and all sorts of different opportunities for vaccination that, again, we've been planning for many, many months. So with that, I'll transition back to you, Lindy.
Thanks. And then Minister Morad, is there anything you would like to leave us with?
I would just like to thank the community in advance for their grace as we move through this. And just to recognize that we are very fortunate that we were selected as one of the regions in the state that are able to deliver this vaccine. That means a lot to us, one of 12 out of 83 counties. So we appreciate that, and we again, thank the community for their patience.
Thank you. And then Chair Hall, I'll end with you.
Thank you, Lindy. I just want to kind of lift up what the Health Director and Administrator Morad had said, and thank you all for your patience and your grace. Again, we hear you, we acknowledge your frustrations. And I also want to thank our county staff, our county employees, for their tireless work over the last year, almost year, on this. Again, I could be more proud to be part of this, this county. And let's do our part. Let's mask up. Let's keep socially distanced. A few more months. We got this, guys.
Thank you. Thank you everyone for joining us today. With the media, if you have any additional questions or follow-up interviews, please reach out to us here at the Health Department, and I'll be happy to get those scheduled for you. Otherwise, thank you very much for joining us today.